Welcome to the Managing Mental Health During COVID-19 partnership between NAMI Chicago and IAMHP, the Illinois Association of Medicaid Health Plans. My name is Elena Kennedy. I'm the Chief Operating Officer at IAMHP, and we are here to remind you that during COVID-19, it has galvanized global action and ushered in big changes that has shut down our usual day-to-day activities. While these steps may be critical to stop the spread of this disease, they have and will undoubtedly have consequences for mental health and well-being in both the short and long term. Which is why the Illinois Association of Medicaid Health Plans, also known as IAMHP, and the National Alliance on Mental Health Illness, NAMI, are partnering to provide mental health resources during the COVID-19 public health crisis. I'm here with Alexa James, the Executive Director of NAMI, who's here to explain a little bit more about the association and what they do.
Thank you so much, Elena. We're so happy to be here. Again, my name is Alexa. I'm the very proud Executive Director of NAMI Chicago, a licensed clinical social worker who has had the privilege of working in the mental health space for almost 15 years. NAMI Chicago is an advocacy organization. We are not a direct provider, although we feel like it more and more these days. We provide information and referrals, education, support, advocacy, and active community outreach for those who are impacted by mental health issues and substance use issues.
Wonderful. We are so excited to be partnering with your organization, Alexa. Here in Illinois, every sector of society is working to identify solutions that address challenges resulting from the COVID-19 pandemic. Vulnerable populations, including individuals with low incomes, older adults, people of color, and those with complex medical and behavioral health and social needs, are likely to be disproportionately impacted, either directly through illness or indirectly due to pressures on health, community, and economic systems. As a trade association representing all Medicaid health plans in Illinois, our mission at IAMHP is to improve the quality of healthcare that helps Illinoisans live longer, healthier lives. That's why we're here to remind you that with all the news surrounding the COVID-19 epidemic, it's hard to understand how to manage your healthcare needs. If you're an Illinois Medicaid member with underlying health issues, it's important to ensure you continue to manage your conditions, take your medications, and keep doctor's appointments. As a friendly reminder, to adhere to social distancing orders in place, health plans are covering telehealth services to allow people to continue regular medical and behavioral health needs. Now, Medicaid members can receive services in a wider range of facilities, including their place of residency or other temporary locations, whether that's within or outside the state of Illinois. So we're here today to talk more about COVID-19 and its impacts on mental health. So I'm going to give it back to Alexa to help us understand how to get support, whether it's stress, grief, anxiety, depression, frustration, or shame. Alexa, can you speak about that a little bit more?
Absolutely. So we know that this pandemic has greatly impacted all of our mental health. We don't necessarily here have to talk about just mental illness, which is a classification of several different symptoms that may present itself over a series of time. What we're talking about is our mental health, which is just as important as our physical health. You hear a lot on the news from your healthcare providers, from PSAs like this, around the fact that we need to take such good care of our physical health to avoid contracting COVID-19. We must do the same for our mental health because we know stressors and life changes and traumas such as we are experiencing with COVID-19 can have lasting impact on our mental and emotional health. So let's talk a little bit about how this is happening. So here's the basic thing about about a trauma. When we think about trauma, the basic definition is loss of control, loss of power. Something unexpected has happened to us. and we haven't had the necessary tools or time to accommodate for this change. This is an absolute feeling that most people are experiencing due to COVID-19. We're worried about our family's health. We're worried about what's going on with our job, which is also very often our sense of purpose, which we'll talk about a little bit later, loss of income, or working from home and remote, working at a pace that is unreasonable, or expectations from our leadership that feel maybe a little bit even out of touch right now. We're worried about what's going to happen next. And many of us don't know, even leadership, right? Like, we don't know what is going to happen next and what our world on the other side is going to look like. We are afraid, and many of us are living in fear. I don't know about you, but every time I go to the grocery store, or I have to run to Target for stuff for my kiddos, or I get an amazing delivery person bringing us food or groceries, I'm worried about contagion, and I'm worried about catching this virus. So let's talk a little bit about some of these stressors, right? So this is the uncertainty, what's going to happen next. So in Illinois, our stay-at-home order has been extended to the end of May. Some people are really looking forward to the time when this is lifted, and some are not. What is this new world going to feel like? What is it going to look like? Is it going to be safe? Are we going to be protected? Are we going to have the resources that we're going to need? We're having a lot of stressors regarding disconnection. We can't connect in the way we used to do with our families, our faith-based communities, our work. Yes, we have FaceTime, and my 5-year-old reminded me last night that in the olden days, he told me we didn't have FaceTime, and now we do, which is right. And we have opportunities to connect through technology, but it's not the same. And for many of us who are living completely alone, not having physical touch, not having that level of engagement, not being able to be collaborative in the work environment like we used to when we would just run into each other in the hallways, that disconnection can make us feel unsteady, and it can make us feel very much alone. There's also significant change that has come with COVID-19. Our routines have been drastically changed, and there's different sides of the spectrum. For some folks, for example, I'll take me for example. Before pre-COVID, I would wake up early in the morning, I would exercise, I would hang out with my kids, take a shower, and get to work. I would work during the day, I would come home, I would do dinner with the kiddos, I'd put them to bed, and then maybe I'd even do something for myself. I feel like a lot of people are experiencing this heaviness from the workflow perspective, where we're literally rolling out of bed early in the morning and jumping right onto calls. We're barely getting our shower in. We're not connecting with our kids in the way that we used to. Our schedules have changed. Or for other folks, they have a lot of time now to fill, and it's difficult when your only options are really to stay in your house or maybe take a walk. I talked earlier about powerlessness. Let's talk a little bit more about this. It's incredibly triggering. We have lost our freedoms, yes? And in some communities and some people may feel validated by this experience because maybe they never really felt like they had power over their experiences, their daily schedule, kind of the programs and policies that influence them. It's incredibly unsettling. And so what we have to kind of start to think about and work on, and we'll do that throughout this conversation, is how do we hold on to the power that we can, and how do we let go of things that are powerless for us? Anxiety is a big one. We're hearing anxiety from everyone. I mean, I think for the first time, this conversation about mental health is no longer siloed, that everyone is experiencing some type of mental health symptom or response during this. Anxiety can look many different ways. It can make us feel overwhelmed. Things that we used to be able to feel like we could manage, like grocery shopping, or raising our kiddos, or getting a project done at work, or taking a shower. All of those things may all of a sudden feel very overwhelming. Many people are experiencing high levels of agitation, grumpiness, anger, sadness, weepiness, low energy. all of that stuff can be from this center of anxiety that many of us are holding. So what does that look like? Well, I've heard from most people that their sleeping is super poor. They're not sleeping through the night. They're waking up with anxieties. Maybe we're eating more than we used to from boredom or just because we're at home more. Maybe we've completely lost our appetite. Maybe things that we used to be able to manage or get through without feeling weepy or sad all of a sudden feel overwhelming grief. This sense of grief is real. Grief does not just exist when we have physically lost someone, and many of us have. Many of us know folks who have died from this pandemic. But grief is also about losing things that we used to have that are no longer available to us. And we have to honor that and understand that grief takes a long time to recover from. I talked about feeling irritable and angry. This social isolation is so easy in this space. And there are many people who have felt so socially isolated for a very long time. And now maybe it feels worse. We don't get to be around people that we want to. We shouldn't be, right? We have to measure, we have to be very careful and cautious. However, not having anybody to talk to all day, not feeling validated, not feeling seen or heard can be a really sad place to live. So we have to think about what are some ways in which we can maintain connection. And then also you may see people yourself or folks around you really start to lose pleasure in activities that they used to find enjoyable. For example, I mentioned earlier how pre-COVID, maybe after I put my kiddos down for bed, maybe when I finished my work for the night, I'd pop on a TV show or watch a movie, and it was such a treat. I can't do that anymore. My attention span is so short that it doesn't feel relaxing anymore. It feels strange to see films and to see television shows that exist in a context that is very different from what we're experiencing now. So my interest in that type of relaxation has changed. Maybe people have stopped exercising and stopped taking care of themselves. Maybe the motivation to do so has changed significantly. So watch out for those signs and symptoms related to anxiety or maybe even depression or just general distress. Again, it does not have to be a diagnosis of an illness for us to lean into each other, metaphorically, check in on each other, and provide support.
Alexa, I also think it's worth noting that sometimes people are isolating also with abusers, people who trigger anxiety and certain stressors in people. And so we also have to be kind to ourselves during that time and look out for our community and see when those signs or stresses are being displayed in our loved ones or friends.
That's absolutely right. Yeah, this is absolutely right. Thank you for bringing that up. I mean, when we talk about home and environment, we can dig into that again as well. It's so important. This is also not a time to judge how each other, how we are coping with this. We are all doing our best. People need a lot of love and space and understanding. This is a great time to check in with our community, which we'll dive into later as well, and say, what do you need today? What do you need from me today? And some people will say, I'm not sure yet, but I'm going to think about it. And what that does is it allows us to start to grow and understand our own insight into what makes us feel better when we are feeling powerless, anxious, sad, or alone. It's funny for some people to talk about life after COVID-19, but I think that we have to start thinking about that. You know, I say very frequently that we mobilized as NAMI Chicago very quickly. We'll talk about what we do more in a little bit, but we were working remotely before the stay-at-home order was put into place. We started about a week before. We kind of saw the writing on the wall, right? Like many people. But I never asked my team if they felt good about that. I never said, all right, how are you guys going to feel about working remotely? Would you rather just continue to work at the office? It was, this is what it is. And that in of itself can be really scary and stressful, right? Having somebody kind of just put a demand or tell you how you have to behave when you don't necessarily feel good about it. Well, here's an opportunity to regain some of that power back. Let's think about what it's going to feel like after COVID-19. When you ask yourself the question, do I want to go back out into the community? Am I excited to go back to work? What is the initial feeling that you have? Is it fear? Is it excitement? Is it insecurity? Let's start prepping for that, because it is going to be a slow integration back. It's not going to be normal. We're not going to go back to the world we knew before. And I think we have to start prepping ourselves, right? So there is going to continue, obviously, to be social distancing, where it makes us feel disconnected, to go into a room with somebody who maybe you used to hug every time you saw them, and that's not happening anymore. Is that going to make you feel rejected, or are you understanding that this is just the way in which we're protecting each other and ourselves? We may have grown accustomed to working from home. The complaint about rolling out of bed and starting your day may be something, but also thinking about now getting up and having to do your hair and makeup, or taking the train, or commuting long hours, that may also feel disruptive as you've gotten kind of accustomed to this. And it will disrupt your daily routine, particularly for people who have other folks to care for. And it may add expense to an already burdened income. So now is really the time to normalize emotions and challenges around transitions. Transitions and change are very difficult for most of us to accommodate into our lives. And so if we start thinking about it and visualizing what it may feel like for us, still with a lot of unknowns, it can be incredibly protective to our mental health.
I think that's a great point, to start normalizing these emotions and challenges around transition, because as we're focusing on the worries and anxieties about living in a world of stay-at-home orders and COVID-19, we also have to start envisioning a life after COVID-19. I know personally the idea of getting onto public transportation, which is my form of transportation, is daunting, because now I have gone from isolating myself in order to protect those I love and myself, to now being in a place where I will have to be very close to people, and it feels unnatural and not normal. Additionally, I know on a personal note, I'm also concerned about being around people for a long period of time after spending a lot of time social isolating and social distancing. So I think that it's important for us to start having these conversations in advance. Thank you, Alexa.
Yeah, absolutely. So let's talk about some support for folks. Let's talk about our helpline, which we are incredibly proud of. So our organization, NAMI Chicago, although in Chicago, certainly support other communities throughout the state, and we've even gotten calls from other parts of the country and internationally. But when to connect to our helpline. So let's just talk of some basic stuff. It's totally free. You can absolutely maintain anonymity when you call. It is helpful to get your information because we do follow-ups with about 70% of our callers. And we are a place that has no time limit. You can call us if you're looking for support services, mental health services. Maybe an example would be a support group or a therapist you may need. Or if you're just kind of like, I'm unsure about what's going on with me or a friend, can we talk about it? We can also be used kind of in consult in that way. It is super easy to call our helpline. The next slide will share a number, but before we get there, there's no waiting, there's no being transferred. Who picks up the phone are the people that are going to be those who are going to support you. And we have licensed clinicians and bilingual clinicians as well on the phone who can help you. And sometimes you'll even get me on the phone. What our helpline really identifies is, what are the gaps? What are the gaps in services? What are the gaps in the needs that will create wellness for you in your environment? How do we identify them with you? And how do we resource gather around you so that you can have access to wellness? Sometimes it's super hard, but we are so, so grateful to have partners like Elena and this wonderful organization where we can connect with them around your insurance plan, who your care coordinator is, and really get all hands on deck for your treatment team, with your permission, of course, so that we can figure out how we can leverage services for you. Some of the ways to connect to our helpline listed right here, the 833 NAMI SHY number, or 833-626-4244. We're open 7 days a week, Monday through Friday from 9 to 8, Saturday and Sunday from 9 to 5. We are also now contracted with the city of Chicago so that all 311 calls that come through Chicago that are mental health related come to us. We have vetted over 600 resources and they are in our database. And so we link folks to those resources that we feel like we can trust. I know that navigating the mental health system is unbelievably complicated. I run this organization. I myself as a clinician, I myself go to therapy, and I have had many interactions with loved ones who have experienced mental health conditions, who need access to services. I know it is a complicated system to navigate. When you call us, we got you, and we will hold your hand through this process, so you do not feel isolated. I want to talk a little bit about the frame in which we use when we are connecting people to services. So we love this SAMHSA recovery model, and we use it all the time, and it's the frame in which we think about our callers, about recovery. When we talk about recovery, it's really living in a space with your mental wellness where you feel like you're functioning in the best space that you can. So let's break this apart a little bit. We've mentioned this, and Elena had talked about this as well when we talked about home, but there are 4 main dimensions for living in a place of wellness. Health, that's obvious, right? Managing your health, both physical and mental health, is incredibly important. So that examples of that could be taking your medication, engaging with a therapist, a psychiatrist, your PCP, any other health professional. Different, mental health is different from physical health. Here's a quick example. My amazing child, who's 5 years old, who is a boy's boy, broke his arm twice in 6 months. Same arm. When he broke his arm the first time, we brought him in, he got a cast. And every few weeks we would go back, we'd x-ray the arm, he got his cast changed a few times, etc. Second time he broke it, he had surgery, cast, another 6 weeks. It didn't matter if I was kind to him. It didn't matter if he had a strong community around him. It would not have changed the way that his bone needed to heal, right? He needed the cast, he needed the medical intervention. It is not the same for mental health. The locus of mental health recovery is not once a week in a therapist's office. It is an element of recovery. We heal in our community. Relationships and social networks provide support, friendship, love, and hope. And right now, many of us are feeling disconnected from that space. So we have to figure out how to be creative to continue to maintain community. Think about it. You can go to therapy and process marital issues that you're having or challenges that you're having and feel like you gained some good coping strategies. But if you go back home to the continued environment that feels toxic, or if you have friends that do not value you or put you down or criticize you, it is going to be very difficult for you to recover in that space. This idea of purpose is huge too, right? This is your meaningful daily activities, job, school, volunteering, caretaking, being creative, all of these things. Again, a lot of this has been fractured due to COVID-19. We don't work in the same way, or we've lost our jobs, or we're caretaking in a way that doesn't feel good, it feels stressful. How are we being thoughtful about purpose? And one of our recommendations is every single day, find something small, creative to do in our home, as was mentioned before. We cannot live in recovery. We cannot live fully fruitful lives if we have unstable housing or if we have an environment that makes us feel unsafe. At NAMI, when you call our helpline, we address all of these areas and coach you and provide resources for you so that all of these areas in your life are connected to. And sometimes we have to do it piece by piece because all at once may be overwhelming.
Thank you so much for that. To our listeners, remember, worries and anxiety about COVID-19 and its impacts can be overwhelming. Social distancing can make those even more challenging. But as you've learned today, you don't have to do it alone. There are numerous resources at NAMI, as well as with the Medicaid managed care organizations, also known as MCOs. There are care coordinators that have special services and programs for Medicaid members who need extra help managing a health problem, including your mental health. Please reach out to your care coordinator if you have specific questions or needs. And if you don't have a care coordinator, please reach out to your Medicaid managed care organization and they will help connect you. You don't have to do this alone. Thank you once again to our NAMI partners for partnering to provide mental health resources during this COVID-19 public health crisis. You can reach out to them at their website, and feel free to also reach out to us at our website. Once again, we are here and you don't have to do this alone. Thank you and have a wonderful day. Stay healthy and well during this time.